Hello and welcome to Medical Dialogue Journal Club, your daily dose of health and medical news. I am Dr. BP Rahul and I am going to talk about a new breast cancer marker that may help in personalized therapy. Crown-like structures surrounding breast tumors in overweight and obese patients were discovered in a new study in University of Southampton, and it was found that these crown-like structures could hinder their response to therapy. The findings of this study could potentially be used to improve personalized treatment for patients with human epidermal growth factor receptor 2 positive overexpressed breast cancer. Adipose tissue or body fat is an important component of the healthy human breast, and yet high body mass index is associated with increased risk of developing breast cancer. Overweight patients also have worse survival rates than patients with healthy body weight. In patients with a high BMI, increased body fat surrounding breast can cause inflammatory immune cells called macrophages to gather in the breast cells tissue. These macrophages can then form what are called crown-like structures by surrounding these fat cells. This creates an inflammatory environment in breast which can lead to the onset and growth of tumors. How these crown-like structures go on to affect breast cancer progression and respond to the therapy is largely unknown. The research team led by Professor Stephen Beers, Ramsey Gutierrez, and Charles Birds assessed sample from group of HER2 positive breast cancer patients to investigate the link between high BMI and formation of crown-like structures and the subsequent effect of these on how patients responded to the therapy with the drug called trastuzumab. The results published in the journal Scientific Reports showed that patients that were overweight or obese had significantly more crown-like structures in their fat tissue surrounding the tumor, and that this was associated with a faster time to metastatic disease, an indication of how well the patients have responded to the therapy. They then went on to identify a potential molecular biomarker called CD32B on surface of the macrophages in these crown-like structures. When this marker was present in overweight and obese patients, their response to the trastuzumab therapy was poorer. Stephen Beers, professor of immunology and immunotherapy at the University of Southampton, said that these findings will be of interest to clinicians and researchers involved in breast cancer treatment, as they could potentially be used to develop personalized treatment in patients with HER2 positive overexpressed breast cancer. For example, doctor would know that patients with a high BMI and the marker on their crown-like structures are likely to have a poor response to trastuzumab therapy. They may therefore benefit from more intensive anti-HER therapy earlier in their treatment. The research team are now looking at the ways to change behavior of these crown-like structure to improve responses to the breast cancer therapy. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.